There is one small muscle group in your body that some doctors quietly call your second heart. You've probably never thought about it. Most people haven't. But every single day, this muscle is working quietly, pushing blood back up through your legs against gravity all the way to your heart. And here's the part that surprises most people over 70. When this muscle weakens, even a little, your legs can start to feel heavy. Your ankles might swell by evening. Your feet might feel cold, even in a warm room. And that restless, achy feeling at night, for many people, it traces back to this exact same problem. The good news? There is one simple movement, something you can do sitting in a chair right now, today, that many surgeons believe is the single most effective thing you can do to help support healthy circulation in your legs as you age. I quote, I'm going to show you exactly what it is. But first, I want to walk you through 9 other things, habits, warning signs, and small daily choices that all lead up to that one final answer. Because understanding the why is what makes the what actually stick. So stay with me. By the end of this video, you'll know exactly what to look for, what to avoid, and what one exercise may help your legs feel lighter, warmer, and stronger. Starting this week. Hello and welcome. My name is Dr. Richard Williamson. For close to 3 decades, I worked as a surgeon, and for many of those years, I spent my days caring for patients dealing with circulation issues in their legs. Varicose veins, swelling, slow healing wounds, the kind of quiet, frustrating problems that don't always get talked about, but affect millions of people quietly, every single day. I quote, V sat across from thousands of patients, many of them in their 70s, 80s, even 90s, and I've heard the same worries over and over again. Why do my legs feel so heavy by the end of the day? Why do my ankles look swollen every night? Is this just part of getting older, or is something wrong? I want you to know something important right from the start. You are not alone in asking these questions, and in most cases, these changes are not something to panic about. They're something to understand, and something you can take small, sensible steps to support. Now, I want to be honest with you, because that matters to me. I am not here to promise you a miracle cure. Nothing in this video is going to reverse decades of wear and tear overnight. What I can offer you, based on years of clinical experience and what the research tells us, is a clear, calm, practical look at what actually helps circulation in the legs as we get older, and what one specific exercise seems to help more than almost anything else we know of. If that sounds like something worth 10 minutes of your time, let's begin with number 10. And please, if any of this feels helpful as we go along, consider subscribing to this channel. I make videos like this every week, specifically for adults who want to stay strong, mobile, and independent for as long as possible. Let's get into it. Number 10. Sitting too long without moving. Let's start with something so ordinary. Most of us don't even notice we're doing it. Sitting. Watching television, reading, sitting at the kitchen table after a meal, riding in the car. All perfectly normal parts of daily life. But here's what happens inside your legs when you sit for long stretches without moving. Your leg muscles, especially the ones in your calves, act like a pump. Every time you flex your foot or take a step, those muscles squeeze the veins in your legs and help push blood back up toward your heart. It's called the calf muscle pump, and it's one of the most important and most overlooked systems in your entire circulatory network. When you sit still for a long time, that pump simply stops working. Blood can pool in the lower legs. Over time, this pooling is associated with swelling, achiness, and in some cases, a higher risk of blood clots, especially on long flights or car rides. Let me tell you about a patient I once cared for. I'll call her Margaret to protect her privacy. Margaret was 74, sharp as a tack, loved her afternoon crossword puzzles. She'd sit in her favorite armchair for 2, sometimes 3 hours at a stretch. She came to see me because her ankles had started swelling every single evening, like clockwork. We talked about her day, and once we mapped it out, the pattern became obvious. It wasn't a scary new disease. It was simply stillness. Too much of it for too long, without a break. I gave Margaret one simple instruction. Every 30 minutes, just stand up, even for 10 seconds. Walk to the kitchen and back if she could. If not, just march in place beside her chair. Within 2 weeks, she told me her ankles looked noticeably better by dinner time. Now, I'm not saying this fixes everything for everyone, but it's a wonderful example of how something so small, so free, so simple can make a real difference. So here's my advice to you. If you know you tend to sit for long periods, try setting a gentle reminder. A timer on your phone, a kitchen timer, even a sticky note on the television. Every 30 minutes or so, stand up. Move your ankles. Take a short walk around the room if you're able. It's a small thing, but it's one of the easiest ways to keep that calf pump doing its job. Now this leads us to something even more specific. Something in your daily posture that might actually be working against your circulation without you realizing it. Let's talk about that next. Number 9, crossing your legs for long periods. I want you to think back to how you're sitting right now, watching this video. Are your legs crossed? For many of us, it's such an automatic habit, we don't even think twice about it. I understand. It can feel comfortable. It can feel natural, even elegant. But here's something worth knowing. When you cross your legs at the knee for long stretches, you can put extra pressure on the veins behind your knee, right in an area where blood is already working hard to travel back up toward your heart. Over time, especially if this is a frequent habit, it may contribute to swelling, and it can make existing circulation issues feel slightly worse. I remember a patient, a lovely gentleman I'll call Walter, 78 years old, retired school teacher. Walter had crossed his legs while sitting for as long as he could remember, going back to his classroom days. He came to me concerned about a persistent achy feeling in one leg, more than the other. When we talked through his habits, it turned out he almost always crossed the same leg over the other, day after day, for hours at a time. Now, I want to be clear. Crossing your legs occasionally for a few minutes is not something to worry about. This isn't about fear, it's about awareness. It's the hours-long, day after day pattern that can add up over time. I suggested Walter try crossing at the ankles instead, which puts far less pressure on those delicate veins, or simply uncrossing every 15 to 20 minutes and shifting position. Small change, big difference in how his leg felt by the end of most days. So here's my gentle suggestion for you. You don't need to eliminate crossing your legs completely, and please don't feel like you're doing something wrong if this is a habit of yours. Just try to be a little more aware. If you notice you've been in the same position for a while, uncross, stretch your legs out, flex your ankles a few times. It costs you nothing, and it may help your circulation quietly, in the background, all day long. Now, let's talk about something you're wearing, or maybe not wearing, that surgeons like me pay very close attention to. It might surprise you how much it matters. Number 8, skipping compression support when it's recommended. If your doctor has ever mentioned compression stockings to you, I want you to really listen to this next part. Compression stockings are specially designed to apply gentle, graduated pressure to your legs, tighter at the ankle, and gradually looser as they go up toward the knee or thigh. This design helps encourage blood to move upward, back toward the heart, working with your body instead of against gravity. Now, I understand why so many people avoid them. They can feel tight, they can be a little tricky to put on, especially if your hands aren't as steady as they used to be, or if bending down isn't easy anymore. I hear this from patients constantly. Let me share a story. A patient I'll call Eleanor, 81 years young, incredibly independent, still lived alone and took care of her own garden. Her doctor had recommended compression stockings for mild swelling in her lower legs. She tried them once, found them difficult to put on, and simply stopped. 6 months later, her swelling had gradually gotten worse, and she came to see me feeling discouraged. We didn't give up on the idea. Instead, we found solutions. There are now compression stocking aids, simple sliding devices that make putting them on far easier, even for people with limited hand strength or flexibility. There are also open-toe versions, lighter compression options, and stockings specifically designed to be easier to manage independently. Eleanor tried an easier style with a donning aid, and within a few weeks, she told me she actually looked forward to putting them on each morning because she could feel the difference by afternoon. Now, I want to say this clearly. Compression stockings are not something you should simply decide to wear on your own without guidance. The right compression level truly depends on your individual circulation, and wearing the wrong strength can occasionally cause more harm than good. This is a conversation to have with your doctor. But if compression has been recommended to you and you've quietly given up on it because it felt too difficult, please don't give up. Ask about easier options. There usually is one. Next, let's talk about something you drink every single day, something so ordinary you might not connect it to your legs at all, but it matters more than you'd think. Number 7, not drinking enough water. I ask nearly every patient over 70 the same question. How much water do you drink in a typical day? And more often than not, the answer surprises them once we actually count it up. As we age, our sense of thirst naturally becomes less sharp. This is simply part of getting older, and it's nothing to be embarrassed about. But it does mean many of us are walking around a little more dehydrated than we realize, and that can affect our blood in a very real physical way. When you're not drinking enough fluid, your blood can become slightly thicker and more concentrated. Thicker blood is harder for your heart and your leg muscles to pump efficiently, especially through the smaller veins in your lower legs and feet. This is associated with that heavy, sluggish feeling many people describe in their legs by late afternoon. I once worked with a patient named Harold, 76, a retired postal worker who prided himself on his daily walks. Harold came to me confused because even though he was staying active, his legs still felt tired and achy, most evenings. When we looked closely at his daily habits, it turned out Harold drank almost no water during the day. A cup of coffee in the morning, maybe a glass of iced tea with dinner. That was largely it. We didn't overhaul his entire diet, we simply added small, manageable goals. A glass of water with each meal, a refillable water bottle he kept by his favorite chair. Within about 2 weeks, Harold mentioned, almost as an afterthought, that his legs felt less heavy by evening. Now, I want to reassure you here, this isn't about forcing down 8 large glasses of water if that feels overwhelming or uncomfortable, especially if you have any kidney or heart conditions where fluid intake needs to be managed carefully with your doctor's guidance. This is simply about paying gentle attention, keeping water within reach, sipping throughout the day rather than all at once. Small, steady hydration can quietly support healthier blood flow, and it costs you nothing but a little intention. Now let's shift to something in your kitchen, because what's on your plate may be playing a bigger role in your circulation than you'd expect. Number 6, a diet high in salt and processed foods. I want to be gentle here, because I know food is personal. It's comfort, it's tradition, it's family recipes passed down for generations. I'm not here to take that away from you, but I do want to share something important about salt, or sodium, and how it relates to circulation in your legs. When you eat foods high in sodium, canned soups, deli meats, packaged snacks, many restaurant meals, your body tends to hold on to extra water to balance out that sodium. This extra fluid often settles in the lower legs and ankles first, simply due to gravity. This is one of the most common and most fixable reasons for evening ankle swelling that I've seen throughout my career. I remember a patient, a warm and wonderful woman named Dorothy, 79 years old, who loved her nightly bowl of canned soup and a small dish of salted nuts while watching her evening programs. She came to me concerned about swelling that seemed to appear out of nowhere every single night. When we walked through her typical day, meal by meal, the pattern became clear. It wasn't one big unhealthy choice. It was a series of small, salty habits stacked on top of each other throughout the day. We didn't ask Dorothy to give up soup entirely. That felt unnecessary and unkind. Instead, we looked for lower sodium versions and added a squeeze of lemon or fresh herbs to bring back some of that flavor she loved. Small swaps, nothing drastic. Within about 10 days, Dorothy told me, with genuine surprise in her voice, that her shoes felt looser by evening. Here, quote, "S my honest, practical advice for you. You don't need to become obsessive about reading every label. Just try being a little more aware of your saltiest habits, the canned soups, the processed deli meats, the salty snacks, and see where you might make 1 or 2 small swaps. Fresh herbs, lemon, garlic, and pepper can add wonderful flavor without the sodium. Small changes here can genuinely support less swelling and lighter feeling legs. Now, let's talk about a warning sign your body might already be giving you. One that's easy to miss, but important to understand. Number 5, ignoring cold feet or changes in leg color. I want you to pay close attention to this next point because it's one of the more important ones we'll cover today. Have you ever noticed your feet feeling unusually cold, even when the rest of you feels perfectly warm? Or perhaps you've noticed your legs or feet look a little more pale, or occasionally slightly bluish or reddish, especially after sitting or standing for a while. These signs are worth paying attention to, not because they're always serious, but because they're your body's way of communicating with you about blood flow. When circulation slows down in the legs, whether from the veins not returning blood efficiently, or from narrowing in the arteries that deliver fresh, oxygen-rich blood down to your feet, temperature and color are often the first noticeable clues. I recall a patient, a kind gentleman named Robert, 83 years old, who mentioned almost in passing during a checkup that his feet just never seemed to warm up anymore, even with wool socks. He wasn't overly concerned. He simply assumed it was just part of getting older. Because he mentioned it, we were able to look further. In Robert's case, it turned out to be a mild, manageable circulation issue that responded well to some of the very habits we're discussing in this video, along with guidance from his doctor. Because he spoke up early, we were able to address it early too. I share this story not to alarm you, but to gently encourage you. If you've noticed persistent coldness in your feet or changes in color that don't go away, please don't simply dismiss it as just aging. Mention it to your doctor. In most cases, it turns out to be something very manageable, but it's always worth having that conversation because catching things early gives you and your doctor more options. Now, here's something reassuring. Many of the daily habits we're discussing today, staying hydrated, moving regularly, watching your sodium, may all help support healthier circulation and warmer, more comfortable feet over time. Let quotes move now to something that happens while you sleep, something you may not even be aware of, but your legs certainly are. Number 4, sleeping without elevating your legs. Here's a question I ask many of my patients. How do you sleep? And where do your legs end up by morning? Most people have never thought about this before, but the position your legs are in for those 7 or 8 hours overnight can meaningfully affect how they feel the next day. Remember what we discussed earlier. Gravity naturally pulls blood downward, and your leg muscles help pump it back upward. But when you're lying flat for hours at night, especially if you've had some swelling or heaviness during the day, that fluid can simply sit there in the same low position all night long. Elevating your legs slightly, even just a few inches, using a pillow or a wedge under your calves, can gently assist gravity in helping fluid move back toward your body's center rather than pooling in your lower legs and feet overnight. Let me tell you about a patient named Patricia, 77 years old, who mentioned that her ankles felt tight and swollen almost every single morning, before she'd even gotten out of bed. This puzzled her because she assumed swelling only happened after a long day of being upright. We talked through her sleeping position, and it turned out Patricia slept completely flat, with her legs at the same level as the rest of her body, night after night. We introduced something simple, a wedge pillow under her lower legs, just a gentle few inches of elevation. Nothing dramatic, nothing uncomfortable. Within about a week, Patricia told me, with real delight in her voice, that her ankles finally looked normal in the morning for the first time in longer than she could remember. Now, I do want to mention, if you have certain heart conditions or acid reflux, elevating your legs or upper body should always be discussed with your doctor first, since positioning can matter differently depending on your specific health situation. But for many people, a slight elevation of the lower legs overnight can be a small, comfortable, and genuinely helpful habit. It's such a simple change, a pillow, a few inches, and potentially noticeably less morning swelling. Now let's talk about something many people over 70 quietly stop doing altogether, even though it might be one of the most protective habits of all. Number 3, avoiding walking because of discomfort. I want to address something with real compassion, because I know this one can be complicated. Many of my patients over 70 have told me, quietly, almost apologetically, that they've simply stopped walking as much as they used to. Sometimes it's joint pain. Sometimes it's a fear of falling. Sometimes it's simply fatigue or breathlessness or just feeling like their legs don't work the way they used to. I want you to know, first and foremost, that these feelings are completely valid. If walking has become difficult or uncomfortable for you, that deserves real attention from your doctor, not judgment from me or anyone else. But here's what's important to understand about walking and circulation. Walking is one of the most natural, effective ways to activate that calf muscle pump we talked about earlier. Every single step engages your calf muscles, which in turn helps push blood back up through your veins toward your heart. It's rhythmic, it's gentle, and your body was designed for it. When walking decreases significantly, that pump slows down too, and over time, this can be associated with worsening circulation, more swelling, and that heavy, tired feeling in the legs becoming more frequent. I think of a patient named Frank, 80 years old, a proud former factory foreman who had always been active but had gradually stopped walking much after some knee discomfort a couple of years earlier. He came to me concerned about increasing swelling and a strange, achy heaviness in both legs. We didn't ask Frank to suddenly start walking miles. That wouldn't have been realistic or safe. Instead, we started incredibly small, a short walk to the mailbox and back. Then, gradually, a lap around his living room during commercial breaks. Then, eventually, a short walk down his driveway. Over several weeks, Frank's tolerance improved, and so did the way his legs felt by evening. It wasn't overnight, it was gradual, patient, and realistic. If walking is difficult for you right now, please talk to your doctor or a physical therapist about what's safe and appropriate for your specific situation. There may be modified options, using a cane, a walker, water-based walking in a pool, or seated exercises that can still help activate that same calf muscle pump, even if traditional walking isn't currently possible for you. The message here isn't, you must walk more, no excuses. The message is simply this: however much movement is safely available to you right now, today, is worth protecting and nurturing. Now, we're getting close to that final answer. But first, let's talk about something surgeons specifically watch for. Something that combines several of the signs we've already discussed. Number 2. Not recognizing the signs of poor circulation early. We've covered quite a bit of ground so far. Sitting too long, crossed legs, hydration, salt, cold feet, elevation, and walking. Now I want to bring it all together because recognizing the combination of these signs early is genuinely one of the most valuable things you can do for your long-term leg health. Here's what I want you to gently watch for, not with fear, but with awareness. Swelling in your ankles or lower legs that seems to get worse throughout the day. Legs that feel unusually heavy, tired, or achy, especially after standing or sitting for a while. Skin on your lower legs that looks shiny, feels tight, or has changed in color. Any new, slow-healing sores or wounds on your lower legs or feet. Or that restless, uncomfortable feeling in your legs at night that makes it hard to settle down and sleep. None of these signs on their own are necessarily a cause for alarm. Many of them are simply part of the natural aging process and can often be improved with the very habits we've discussed today. But here's why early recognition matters so much. I once cared for a patient named Susan, 72 years old, a retired nurse herself, who actually recognized several of these signs early. The mild evening swelling, the occasional heaviness, a small, slow-healing scrape on her shin that just wouldn't quite close up the way it used to. Because of her background, Susan didn't wait. She brought all of this to my attention at once, rather than one small complaint at a time over several years. This gave us a complete picture much earlier than we typically get, and allowed us to put together a thoughtful, proactive plan, combining several small daily habits, along with guidance from her care team. 2 years later, Susan told me her legs felt better than they had in nearly a decade. I share Susan's story because I want to encourage the same approach in you. If you've noticed a combination of these signs, please don't wait for them to become severe before mentioning them to your doctor. Early conversations lead to more options, more comfort, and often much better long-term outcomes. You know your body better than anyone. Trust that instinct. Now we've finally arrived at it. The one exercise that, in my experience and based on what much of the research shows us, may offer more benefit for leg circulation in people over 70 than almost anything else we've discussed today. Let's talk about number 1. Number 1, the seated calf raise and ankle pump. Here it is. The exercise many surgeons, myself included, consider the single most effective, accessible movement for supporting healthy leg circulation as we age. It quotes called the ankle pump, sometimes combined with a seated calf raise. And the best part? You can do it sitting in a chair right now, without any special equipment, without leaving your home, and without putting any strain on your joints. Here's exactly how it works. While sitting comfortably in a sturdy chair with both feet flat on the floor, Simply lift your heels up off the ground as high as comfortably possible so you're balancing on the balls of your feet. Then slowly lower your heels back down. That's one repetition. You can also add ankle pumps, simply flexing your feet up toward you, then pointing your toes down away from you, like you're gently pressing a gas pedal and then releasing it. Why does this particular movement matter so much? Remember that calf muscle pump we discussed throughout this entire video? This exercise directly activates it on demand in a controlled, gentle, seated position. Each time you raise your heels or flex your ankles, your calf muscles contract and squeeze the veins running through them, actively helping push blood upward back toward your heart, working with your body's natural design rather than against it. Unlike walking, which some people may find difficult due to joint pain, balance concerns, or fatigue, this exercise can typically be done safely by almost anyone who can sit in a chair, regardless of their current mobility level. It's low impact, it's gentle on the knees and hips, and it can be done virtually anywhere, while watching television, while on the phone with a grandchild, even while waiting at a doctor's appointment. Let me tell you about a patient who brought this exercise fully into focus for me. Her name was Ruth, 85 years old, and she had significant mobility limitations following a hip surgery years earlier. Walking any real distance simply wasn't an option for her anymore. She'd resigned herself to ongoing swelling and heaviness in her legs, believing there wasn't much she could do about it given her limited mobility. I introduced Ruth to seated ankle pumps and calf raises. Just 10 repetitions 3 times a day while sitting in her favorite chair. Nothing complicated. Nothing that required her to stand or risk a fall. Within about 3 weeks, Ruth told me, with tears in her eyes, that her ankles looked almost normal by the end of the day for the first time in years. She said it gave her back a sense of control over her own body, something she hadn't felt in a long time. I want to be very clear and responsible here. This exercise is not a guaranteed cure, and it will not reverse every circulation issue. Some conditions require medical treatment, medication, or procedures that go beyond what any exercise alone can accomplish. If you have significant swelling, pain, wounds, or changes in your legs, please see your doctor for a proper evaluation before starting any new exercise routine. But for many people, this simple, gentle, seated movement is associated with meaningfully improved circulation, reduced swelling, and legs that feel lighter and warmer by the end of the day. Dot here quotes how I recommend starting, safely and comfortably. Begin with 10 to 15 repetitions of the seated calf raise, followed by 10 to 15 ankle pumps in each direction. Try to do this 2 to 3 times throughout your day, perhaps once in the morning, once in the afternoon, and once in the evening. If you're able, and your doctor has cleared you for it, you might eventually progress to doing this while standing, holding onto a countertop or sturdy chair for balance. That's it. That's the exercise many surgeons quietly recommend more than almost anything else, for one simple reason. It works with your body's natural circulation system, it's gentle, it's accessible, and it genuinely fits into daily life, no matter your current mobility level. Let's bring everything together because I want you to walk away from this video with real clarity, not just information. We talked about the importance of avoiding long periods of sitting without moving. We discussed being mindful of crossing your legs for extended stretches. We covered the value of compression support when your doctor recommends it. We talked about staying gently hydrated throughout the day and being aware of salt and processed foods in your diet. We discussed paying attention to cold feet or changes in leg color and the importance of elevating your legs while you sleep. We talked about the protective value of walking, however much is safely available to you, and the importance of recognizing the combined signs of poor circulation early rather than waiting. And finally, we arrived at the seated calf raise and ankle pump, a simple, gentle, accessible exercise that may offer more support for healthy leg circulation